and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And with me today, I have a special guest, Michelle Donahoo. Welcome, Michelle. It's good to have you back here at Gold.
Thank you so much for having me. I'm excited to do the presentation.
And yes, indeed, you are part of the Gold Neonatal Online Conference, which we get started with just around the corner on June 3rd with our keynote presentation. Your title and your topic is fascinating. It's really, I'm looking forward to it. It's the presentation title is Evidence-Based Approaches to Neonatal Oxygenation and Intubation Care. Can't wait to talk to you about that. But first, for our viewers who haven't had a chance to watch you here on Gold in a previous neonatal conference, tell us a little bit about your background and your work.
Yes, absolutely. So I've been a respiratory therapist for 25 years here coming up in June. And I've worked in the neonatal ICU the whole time, maybe about the 6 months into my career. So I've worked for level 3 neonatal ICU down to a level 1, lots of education associated to neonatal resuscitation and stabilization. And I've been the respiratory specialist for the NICU. So lots of evidence-based practice and policies and competency and those types of things for staff. So lots of experience with babies.
Wonderful. I mean, that must have been something that spoke to you right away, so early on in your training that you absolutely wanted to be there in the NICU, correct?
Yes. Oh, yeah. I love the babies. They're just innocent and perfect and such warriors there. So I
Yes.
really enjoy it's very rewarding.
Yes, I can imagine. Yes, you're right. They are just little warriors there for sure. So let's talk a little bit about the topic and respiration. Obviously, that is your thing, that is your expertise.
Yeah.
So, little ones in the NICU, they are very vulnerable. So why are they particularly vulnerable to oxidative stress and such? And what are the consequences of over oxygenation? Because that's the other side of it, right? We need to oxygenate these little ones, but what happens? Is there a risk to do it too much?
Absolutely. There's a lot of good information. Oxygen sometimes isn't looked at as a medication, which is really what it is, even though
Mhm.
obviously it's an inhaled form of
Mhm.
respiratory medication. But we want to be sure that we are targeting appropriate saturation ranges for those babies, whether they're preterm or even a late preterm baby. The way their bodies react to excessive oxygen can
Mhm.
be just as damaging as not having enough and having a low oxygenation. So it's trying to find that balance and lots of good new evidence about that and trying to keep within target ranges. So it's lots of good information.
Yeah, and I can only imagine it must be very tricky to keep that level, the right balance of it. Um, Tell me a little bit more about this. What strategies or tools would be helpful or are helpful?
Yeah, I think now with the neonatal resuscitation program guidelines really instituting monitoring of patients with pulse oximetry
Hmm.
and the ECG leads, we're able to really track the heart rate and oxygenation responses to interventions as we are doing them as soon as the babies are born, and really using those target saturation guidelines through the resuscitation. And then once they get back into the neonatal ICU, or if you have a nursery where you're stabilizing, really
Hmm.
trying to target a good appropriate range based off of their gestational age. One answer for oxygenation saturation ranges is not typical. It will depend and fluctuate based off their gestational age. So
Hmm.
in just being very mindful that we're always adjusting and weaning or increasing if we need to keep it within our target goals.
Absolutely. Yes, absolutely. That's very important. Now, your presentation, I'm really excited about this. You have two parts in it, right? Like you have
Mhm.
structured it in a way, you have two parts, and you also go
Yeah.
into intubation care. And this is also a very, very tricky topic, especially with these little ones. Um, we were talking about endotracheal tube and dislodgement, right? There is some risk
Mhm.
associated with that. And things can happen. So tell me a little bit more about that second part of your presentation.
Yeah, I think when it comes to placing an advanced airway, there's options now with the laryngeal mask airway or the endotracheal tube. And we are intubating less and
Mm.
placing those advanced airways because of how we're managing patients obstetrically before they're born. Certain medications really getting their lungs the best
Mhm.
opportunity to not need to have an invasive ventilation and an endotracheal tube. So that makes it a little bit interesting when we want to
Mhm.
have an intubated patient. We need to make sure that we're continuously assessing the tape or the
Right.
securement device, and we're monitoring it based off of procedures and how we're adjusting and moving the patient. So, again, lots of good information to kind of go over ways to hold the tube,
Mhm.
and try to prevent those accidental extubations for those babies as well.
Wonderful. Yeah, there's so much good information that you will share with us. I'm thinking yeah now about the parents. For parents, this is of course a very stressful time, right? Like they have a little one, maybe it wasn't expected, baby was born early, or certain medical issues happening there along the way. Parents still, recovering from birth themselves. What are you doing to include the family in the care? Because they're really the experts in their baby, right? So how is your unit and how is your team integrating parents into this?
Well, I think that's something that we start automatically.
Hmm.
When we're in the delivery room, we are, talking to the partner, getting that involvement right away, including them over to the transport into the other area, getting mom over as soon as possible, working towards skin to skin,
Mm.
and positioning those patients that are whether they're intubated or receiving, other non-invasive modalities, trying to get that bond and having them pitch in with the care as we transition through. And really you're just educating the family on things that are going on throughout the whole time so that they're involved and they know why we're doing certain things or what's alarming and why that's alarming type of thing. So, it's just as soon as they're admitted, we are discharge education is kind of how I say we're working on letting them know kind of what's going on and what to expect as we're moving along through their care.
Wonderful. Yeah, integrating them into, in being partners in care. Love that. Now you've been doing this for a very long time, right? Like,
Mhm.
and
Yep.
and you've probably seen a lot of change in your years. Is there anything that stood out to you, or, looking back over that time that is so different now to when you started?
Well, I definitely think the number of patients that we're intubating and placing those advanced airways has drastically changed,
Hmm.
which makes it more complex for
Hmm.
educating the staff on placing these critical airways, especially as we talk about those very low birth weight patients that, it's hard to simulate those types of things and keeping the skills up of getting those advanced airways and then, of course, securing them and monitoring them. Drastic changes in the last 25 years with intubation.
Mhm.
Yeah,
Yeah, I can
a
only
lot
imagine.
less.
Yes.
Mhm.
Now, Michelle, before I let you go, any final wise words to our audience, and what are you hoping they will be taking away from your presentation?
I don't know if I have any wise words, but I'm very excited to do the presentation. I think, medicine always evolves, which is so great
Mhm.
to see and be involved in educating people of what the current evidence base is when it comes to, again, monitoring oxygenation levels or oxygen therapy, and then transitioning into those advanced airways as well. So, lots of good updated evidence and reasons why we're switching, um, which makes us want to implement that into our practice if we understand the why to what we're doing and why we're changing it. So I'm excited about
Beautiful.
that.
Well, thank you so much, Michelle Donahoo, for being here with me today, talking about the wonderful work you're doing there in your unit and as an educator as well, and about your presentation here at Gold. Thank you so much.
Yeah, you're welcome. Thank you.
And now some information for our viewers. The presentation Evidence-Based Approaches to Neonatal Oxygenation and Intubation Care is part of our Gold Neonatal online conference here of 2025, which is just around the corner. We get started on June 3rd with our open access and free keynote presentation. So if you want to find out about Michelle's presentation, the keynote, and all the other wonderful presentations in the conference, we invite you to go to goldneonatal.com. And I hope to see everyone at the conference. Bye-bye, everyone.